On behalf of Healthgrades, I want to thank everyone in the audience and especially on our panel for taking the time to join us today. I think we had a very important and impactful discussion we'll get through with some excellent industry leaders. Before I introduce all of our panelists, I want to quickly introduce myself. My name is David Brommel. I'm Vice President of Quality Solutions Division with Healthgrades, where we're focusing on helping hospitals and healthcare systems promote, measure, and improve clinical care, focusing on empowering consumers with clear and understandable information to make informed healthcare decisions, and promoting transparency and data-driven quality improvement across the healthcare industry. It's an honor to be able to facilitate this discussion today, focus on the power of hospital quality, the strategies hospitals and health systems are leveraging to make clinical excellence a strategic differentiator, and the benefits being seen from these efforts. We'll touch on how these efforts are accelerating brand strategies, how these are driving community and patient engagement, how they're driving employee engagement, and also supporting growth and other strategic initiatives across the hospitals. We have three amazing panelists joining us today, each representing a high-performing hospital or health system with numerous national distinctions from Healthgrades for specialty care, patient safety, and overall clinical excellence. Before I ask our panelists to introduce themselves, I wanted to take a minute for those on the call less familiar with Healthgrades, our awards, our ratings, and the methodology behind those, to make sure everyone is fully aware of that process before we dive into how to leverage those. To assess hospital performance, Healthgrades uses a comprehensive, risk-adjusted, outcomes-focused methodology, all of which is downloadable from healthgrades.com. We focus on over 35 procedures and conditions, now including outpatient orthopedic surgery. We analyze complication and mortality rates exclusively, patient acuity levels, and key comorbidities to help assess actual versus predicted outcome rates for negative outcomes across hospitals across the country, to identify top performers. Top performers in these areas are recognized with 5-star ratings, specialty excellence awards, state rankings, and potentially even America's Best Hospital honors at the specialty care level or for overall clinical care. Healthgrades also looks at patient experience and patient safety in our assessment. Looking forward to hearing more about how our panelists are leveraging these. And I've had the pleasure of spending time with each of our panelists, and I've seen firsthand just how effectively each of their organizations is leveraging their clinical success and focusing and highlighting the care of their teams across the hospital. I'm excited for others to hear, to learn from the work of these extraordinary healthcare leaders. And with that, it would be great if we could go around the table, so to speak, and hear from that. Stephanie, could I hand it off to you to make a quick introduction and share a little bit about the work you're doing with River's Edge?
Yep, absolutely. Thank you so much, David. My name is Stephanie Holden, and I'm the Chief Experience Officer at River's Edge Hospital in St. Peter, Minnesota. We're located about an hour south of the Twin Cities metro area. And St. Peter is a community of about 12,000 people, and we have a 25-bed critical access hospital. In 2014, we started an orthopedic partnership with a clinic about 12 miles south of us. And that partnership has really put us on the map as far as patient experience, patient quality, and excellence in orthopedics. We were the first critical access hospital recognized by DNV as an orthopedic center of excellence. And we've been nationally recognized for patient safety, quality, and patient experience by several different organizations, most notably Healthgrades, where we have the honor to be #1 in the state of Minnesota for orthopedic surgery and #5 in the state for joint replacement surgery. And we're a top 100 hospital in the nation for orthopedic surgery. So I'm excited to share our story, and we'll turn it over to who's next.
Darian, you're next on my screen if you want to jump in.
Happy to jump in. Thank you again, David and Stephanie, for handing off, and everyone here for joining the discussion. I'm Darian Harris. I'm the CEO at Sutter Health Mills Peninsula Medical Center. We have 301 licensed beds here in Burlingame, California. For those not familiar, we are in the Bay Area. as a part of the greater Silicon Valley within our broader Sutter Health organization, largely based in Northern California, as well as some sites in Southern California as we continue to expand as an organization. Here at Mills Peninsula, we're incredibly proud of the tremendous history that we have in clinical excellence, and certainly the collaboration we've had with Healthgrades, most notably and recently being recognized with the Healthgrades Triple Crown, which recognizes everything from patient safety and quality, as well as patient experience, and overall top 50 hospital in the country based on that clinical criteria and really rigorous process that David outlined earlier in the discussion. And if I recall, I think we're the only hospital in the state of California, and only one of handful in the country to be recognized with the Triple Crown, and to be done so 2 years in a row. So we're very proud of that, and proud of the great work that the teams do on a daily basis to continue to differentiate. And that's in our focus. And we're in a very vibrant market with large as well as small independent organizations around us, and really well-informed patients in our communities, and really find that there's a key emphasis on the necessity for us to tell our story in a meaningful way. And I think this Healthgrades recognition is a great way that we get a chance to do that, and hopefully we'll get a chance to share a little bit more about that. And personally, I've gotten a chance to work kind of all four corners of the country, from academic medicine to large health systems to smaller hospitals and facilities as well. And so looking forward to the discussion, and really seeing sort of the utility transect all those different dimensions of the healthcare industry, and look forward to sharing anything I can that may be supportive to the audience here.
Darian, thank you so much. Thanks for joining. And Mark, without further ado, it'd be great to hear a little bit from you.
Thanks, David. My name is Mark Reese. I'm on the corporate communications and marketing team for Prime Healthcare, which is a 44 hospital health system in the United States, stretches across 14 states. It's one of the largest physician-founded healthcare systems in the U.S. I also have the privilege of being the business development and marketing director for St. Mary's Regional Medical Center, which is a Prime Healthcare hospital in Reno, Nevada. We are a 352-bed acute care hospital with an integrated medical group that comprises one of the larger health networks in Northern Nevada. Our hospital specifically has been ranked and recognized as a top cardiovascular hospital in the United States, as well as receiving the most patient safety excellence awards of any hospital in our region. We have a very competitive healthcare market in Northern Nevada, and we certainly see an increasing population here as I think more and more recognize what our region has to offer. So excited to be with the group here today.
Thank you all for that great kickoff there. And Mark, maybe to stay with you for our first question here. I've had a great chance to hear from you and the team at Prime about how the awards are really part of how you build the culture and how you help, make sure all your employees and the team there are kind of aligned in the same direction, and how that really starts from day one. And I'm curious if you could kind of share a little bit about how, just how you're doing that, how Prime and St. Mary's specifically is integrating the awards into onboarding and to really identifying, clinical excellence as core to the mission and culture of your organization and for each of your employees.
Absolutely. So you mentioned day one, right? So I'll start there. At all of our hospitals in the Prime system, every week or every few weeks, there are new hire orientations, which I'm sure is consistent with a lot of healthcare organizations that are on this call. And during those, the executive team has a portion or presentation where they review lots of things. They introduce themselves, and the first thing they talk about is awards and clinical excellence. And right on that slide are the healthcare designations that the hospital has. Again, from the Prime standpoint, Prime ensures that all local sites are aware of what designations they do have in their regions, whether, again, it's at the health system or hospital level, and then ensures that those individual hospitals, those local sites, get that messaging out to the employees. So every week, every 2 weeks, there are refreshed groups of 40 or 50, depending on the size of the class, new employees that are aware of the significance of these awards, that understand what they represent, and that certainly convey the executive team's interest in not only being proud of earning these, but in that continuing. It's something that Prime as a system and local hospitals view on par with clinical differentiators. So when you think about pull factors into your hospital, perhaps it's going to be new equipment or new procedures that represent opportunities both to expand access to care, but then also, again, identifying market share that is a differentiator of any other competitor in your market. And that's something that we view these clinical awards and this clinical excellence recognition on par with that.
That's great. And Stephanie, I'd love for you to share some on there too. I know you've shared some great comments on with me on how the awards are part of the employee engagement committee now, and there's some really great stuff that's going on there, and even part of your recruiting. If you could share kind of some from your view on how it's helping build the culture and grow the culture at River's Edge.
Sure. So back in 2015, I started doing an annual River's Edge t-shirt, just to, give a t-shirt to wear to our employees, because, who doesn't like to wear the name of the place they work at, right? Plus it's a great way to have mobile billboards all across our region. So, we recently started an employee advisory committee, and the employee advisory committee had asked if we could have more River's Edge t-shirt days. And we put some thought into this because we knew that, a lot of our staff had a lot of different t-shirts, but not everyone had the same t-shirt. So what we had decided on was just a plain black t-shirt with our logo on the front, and like, yep, this is great. We give them out at orientation. And around the same time we were doing this, we learned of our #1 recognition from Healthgrades. So we decided to use our new t-shirt as an opportunity to put that logo on the right sleeve of our t-shirt for our River's Edge Hospital t-shirt day. So I thought, as I was thinking about placement, originally I thought, well, the back of the shirt would be great. But I thought, if we're wearing these at work and the majority of our staff are right-handed, I'm going to put it on the right sleeve. So when they're doing patient care, that logo is right smack dab in front of our patients, and they can see that we're #1 for orthopedic surgery. So makes us feel good, and it gives the patients some peace of mind knowing that they're at an organization that really is truly dedicated to the work that they're doing.
Yeah, and Darian, maybe opening up to you, I remember something that stood out for me from one of our conversations is, you really highlighting that, people want to be part of an exceptional team. And, Stephanie, I know River's Edge is using it in some of your recruiting. Mark, Prime has it on day one, and Darian, I'm just curious if you could talk a little about how, having these, great awards, the Triple Crown, national leaders, and clinical care awards. Have you seen that as something that's helped you, grow your team and really help attract top talent who is likewise, committed to, delivering on that promise of clinical excellence that the awards are speaking to?
Absolutely, David. I appreciate that, and certainly appreciate the comments from Mark and Stephanie, because they resonated, deeply with me as well. I think, to your point, what gets celebrated gets replicated. And I think, to a certain extent, understanding what you want to be known for and what we seek to be known for as an organization is certainly the exceptional and differentiated quality that we have, and really an exceptional sort of totality of the network of care. And that attracts exceptional people who are looking to be a part of that team that values clinical excellence, that values, a focus on patients, that values the excellent journey, which is consistent, pursuit of progress. And so for us, and certainly appreciated you getting a chance to join as well. We've taken opportunities after the celebration and recognition that we received from Healthgrades to bring our teams together. This is really a team recognition of the tremendous work that they do on a daily basis. And so, in bringing that together, how do we find, powerful ways to share that journey, not only with the teams that are here to continue to inspire them to get that fulfillment and understand, the great work that they do, but also in our recruitment efforts and leverage some of those materials that we develop to bring visibility as not only our patients become more and more informed, but our workforces are looking to understand, particularly in competitive environments, the differentiation from one hospital to another, and they're looking for that, the right fit for them, certainly in advance of joining a team. And so being able to understand who we are, align with clinical excellence, how we tell our story through multi-channel means, and leveraging sort of the recognition of Healthgrades as a vehicle in a common language that people look for, irrespective of the state that they occupy. We've really found tremendous success and have continued to see, rapid rate in a very competitive recruitment environment, increasing in our teams, as well as increased retention as we tell our story, which is really exciting, particularly as we're coming out of the pandemic.
That's great. I appreciate you sharing. And I'd love to, you hit on it a little bit, and the phrase always comes to mind as, healthcare is a team sport, right? And so it's very much inclusive of our executive leaders, our clinical care teams, the marketing, the branding teams, the finance folks, even, right? They're all part of delivering that, but also part of that team is the patient, is the consumer who's coming in. And Darian, you shared something also that I thought was great, that as hospital leaders, as a hospital, as healthcare services, we're often interacting with patients during peaks, pits, milestones, and transitions, right? These difficult times. And you had some great discussion about how, about kind of what the hospital and healthcare system's role is in making that as soft a landing for the patient as possible, and really, building trust and trying to increase health literacy and comfort with healthcare decisions before they're making it. I'm curious if you could, speak to, what role do you think the awards that Sutter has, Healthgrades or otherwise, plays in setting a patient up to come in and receive the care that they're looking for. And then Stephanie, Mark, I'm very eager to hear your thoughts on this as well.
Yeah, I appreciate that, David. And, I think you highlighted it very well. I mean, there's a ton of research that really supports we as human beings remember peaks, pits, milestones, and transitions. And to Mark's point around how we're orienting our teams from day one, a lot of the conversations we're having is recognizing every time a patient is coming into one of our facilities, they're asking for help, right? They're experiencing one of these peaks, pits, milestones, and transitions, the best moments in life, the most vulnerable moments in life. And realistically, sometimes it's the small things, sometimes it's the big thing that alleviate the concern during this vulnerable time. And what's more powerful than us shaping the most meaningful moments of people's lives? And so fundamentally, it's a requirement. It's foundational for us in the bond and the connection that we have with our community and the patients that we serve, that we're able to, help bring visibility and comfort to them as they're seeking help and services from our teams. And I think finding a language that is understandable and digestible to our communities, like Healthgrades recognition, like redesigned tools and techniques and patient communication, is really critical, right? It's challenging enough going through recovery process, and even if you're getting the best care in the world, our ability to alleviate the concerns on the front end by instilling in the community a sense of confidence in the care that they're getting right near, close to home, is a key part of the learning and recovery journey. Whether it's my experience here or in another organization, as people recover closer to home and have that stress alleviated, their treatment process gets better, the outcomes get better. And so it's certainly been a key focus for us here in our community, whether it's engaging Rotary to, we've established building wraps on the outside of the building, but every time that our patients, drive by our facility, or every time they walk in the door and they see a trusted brand like Healthgrades, bestowed on the wall and consistently year over year, that instills a sense of confidence that when they go and they engage with our clinicians and our caregivers, that they're getting that best care possible, only helps the care that they provide, and it helps us differentiate and grow, our services. And so it really is a meaningful and key element of every program development effort that we have, is finding a digestible means to communicate really differentiation in a way that our patients resonates with our patients.
Mark,
So-
Stephanie, anything?
oh,
Yeah, please.
Yeah,
Please.
I'll I'll start, David. So for me, with this aspect with our patients is, definitely the marketing and promotion of this is key. And when we started our partnership with Healthgrades, what was really important from our aspect was to make sure as many people as possible were seeing that emblem. We had already been building a really nice reputation in our service area for patient experience. But from the clinical side, that came we knew that we were doing well, but the recognition came after. So it was very important for us to see that and talk about it. So after our first Healthgrades recognition, we took the opportunity to do kind of a state of the hospital addresses with our local service clubs and other organizations in the area, just to explain what Healthgrades is and how Healthgrades can help the consumer find quality health care and what the recognition meant for our organization and our partnership with the orthopedic clinic. And that has been really successful for us. And like what I said when we had met prior is I put that emblem everywhere, and it's on billboards, it's in our joint camp book, it's on our t-shirts, and it's on our TV commercials, it's on our Facebook, it's everywhere. And what's really validating for me is when I get our patient surveys back and I'm looking at the comments. And just recently, well, yesterday actually I was looking at comments from our med-surg patients, and one of them just stuck out with me, and it said, I was so well cared for, I thought I was on a cruise ship. And if that's not validation, I don't know what is, because when you're on a cruise ship, you're well taken care of, all your needs are met, and you're comfortable and relaxed, and it doesn't get much better than that.
Yeah. And Mark, I'm sure you've got some good stuff to share here. I know you've shared some comments about feedback from patients and whatnot as well. So anything you have to share here would be excellent.
Sure.
Yeah.
So, as we know, quality and safety drive everything in healthcare. As it's been shared, right, these quality and clinical awards are integrated into our mission. They're hardwired into our hospital, but then the important part becomes leveraging that and ensuring that that message is understood and explaining why it's important for the community. And when we talk about leveraging quality and safety metrics, especially when you're a high performer, it's advantageous not only because it's an attractive PR and messaging opportunity, but it's in the patient's best interest, right? If you're a top site clinically or top site for whatever specialty that's at hand, being able to convey that message really instills a sense of confidence in patients. That's what we see. And it's certainly reinforced also by the ease of digesting the collateral and the award. It conveys something that is, considered to be an exceptional award from this objective third party. And again, just collectively, all of those results in something that's really positive and a message that's really easy to understand. And it's something that we see with all the patients that interact with our health system.
Yeah, and I think you've all touched on it perhaps slightly here, but I'm curious if anyone would have anything to add specific about how you get buy-in amongst your physician groups around talking about these awards. I think, Stephanie, you talked about how your physicians are maybe 100% engaged on this behind maybe some of your prodding, but I know there's a lot of challenge out there with making sure the docs are driving patients where you want them and engage at the level you want. I'm curious if you all had anything to share about kind of physicians' reactions to promoting these awards and how this has maybe improved or put your physician engagement on a little bit of an elevated trajectory.
Well, for us, we're kind of we sometimes refer to ourselves as a unicorn. None of our physicians are employed by us. They're all contracted. And our partnership with this orthopedic clinic, we're two separate entities. But I have never seen so much physician buy-in and engagement from physicians than I do with this group that we get to work with every day. They're so excited about the recognition. And I think that all comes from the communication that they're provided from all of us on the C-suite, because quite honestly, Rivers Edge Hospital wouldn't be the #1 place in Minnesota for orthopedic surgery if it wasn't for this group of physicians who are doing the work, and our nursing staff. And even though we're separate, there is very much so a sense of teamwork. And it just rolls all back to what Mark and Darian had talked about too, is about how you're communicating your culture and what those expectations of your culture is. And we're not any different than Darian and Mark's organization, where that high performing, award receiving organization is part of our culture. It's kind of just what we do.
And Darian, Mark, I know you both have, in California and Nevada, there are, challenges with physician alignment as well, just because of the nature of those states. I'm curious of your perspective on that, and then anything in terms of, has it helped physicians become more, not that physicians aren't 100% focused on clinical performance now, but has it helped them kind of perhaps be a little bit more competitive about getting that top grade?
I can jump in and certainly hand off to Mark as well. Each state has its own uniqueness. California is certainly front and center, I think, in some of that. But I had an opportunity to join this organization about a year ago, and we've been on an interesting journey. I think as a Sutter Health organization, the last year and a half under our new CEO, Warner Thomas, we're going through a pretty transformational, process. And there's increased organizational appreciation for the necessity for us to recognize the everyday excellence that happens on a daily basis in a much more meaningful and prominent way, to help propel and inspire continued excellence. And so what I'd share is, particularly as it interfaces with our physicians, joining the team here about a year ago, we have very engaged physicians who set the highest bar of excellence and quality, and doing some really amazing clinically sophisticated things. But I spent some time in one of our early discussions asking, I reviewed all of our awards and recognition, and I asked the team, okay, so how many people know that we were recognized as Healthgrades top 50 hospital this year? How many recognize this? And what I ended up finding was that there was a gap between the amazing work that were happening. There's a recognition there, but we have this opportunity to bring such visibility to our teams, and not just go from day to day, but take the moment to pause, to celebrate that excellence. And so what I really found in finding more prominent ways to celebrate as those recognitions come in, is an even more engaged medical staff who takes a lot of pride in these recognitions, because I think Stephanie had mentioned, we had always done exceptional work and great work, but we don't always take the opportunity to bring visibility to just how exceptional, just how differentiated. And so we've seen, I think you'd mentioned kind of the competitive spirit. I think you got a chance to join us during our recognition. Team was so excited to certainly be, recognized as a top 50 hospital again. And then the conversation was, how are we going to do it again next year? Right. And that's the spirit of continuous improvement and excellence that, you want woven into the fabric of who we are. And so super proud of the team for that. So, and I think Healthgrades is a great vehicle to help bring that conversation to light. And so happy to hand over to Mark to share anything he might add.
Yeah, well said, Darian. Kind of getting back, to the original aspect of physician buy-in, physician engagement. When we receive these awards, perhaps one of the first things that we recognize is the importance of that direct physician engagement. Primarily, that's because physicians are intimately involved with any health system or hospital that receives these awards. So expressing gratitude, but also emphasizing, right, that this is a safe place for care. And we see that yields a really positive impression with our physicians in this market. Positive because certainly they are pleased to know that this hospital is committed to clinical safety and clinical quality, as well is something that we're going to continuously track and strive for, and that's the direction of the hospital, so to where we want to continue to be a safe, trusted place for healthcare, and that's something that we really see resonate with our group here locally.
That's great. And Mark, maybe to stick with you, like to move a little bit into some of the just understanding. We've got a lot of marketing operators and marketing leaders on the call with us today. Chris, we could shift a little bit to talk about some of the specific tactics, campaigns, and then some of the let's say measurement targets and goals that you've put behind campaigns that are focusing on Healthgrades, and just give the audience maybe a sense of what you see as working well, some of the different channels that are having good impact in terms of telling this story, and changing perhaps perception or elevating just awareness of hospital programs. And then also, I think each of our panelists comes at perhaps the measurement from a slightly different angle, given their role in the organization. Would love to just for each of you to share a little bit about how you think about a not necessarily an ROI, but what are you looking to get out of a engagement or a specific campaign, and then how are you perhaps measuring and sharing those measurements with some of the more analytic, perhaps finance or CFOs out there who are trying to be very good stewards of hospital dollars.
Absolutely. So starting off right with all things related to the marketing channels and avenues, consistency is the big word that we strive for here. So we already mentioned that our new hire orientation, we hit it really hard when it comes to awards and the understanding of the significance of these clinical differentiators. So then now when we take that next step to the public facing and the marketing approach, what we really like recognizing the importance of these awards is on social media, being able to initially have that first touch point of, okay, here's the award, here's a write-up, here's how you can help digest this as a potential reader. And then in that post, that's going to link to a full press release that is on the website that contains further talking points, expanded words on what this means, what the context is, why you should care as a viewer, and what this means as it relates to you choosing spots for your source of your healthcare. We then, in addition to that, will pursue radio, digital ads, and streaming, kind of all under a shared bucket to, again, get this same or similar message. That's why I say consistency, to where now there's 4 or 5 different complementary channels to where any person, in that community has a really high likelihood of interacting with that and hearing for the 4th, 5th, 6th consecutive time something about award-winning patient safety, clinical quality, and they're really starting to digest that and get to a level that now we approach the actionable item of transitioning out of ROI. What impact did this have? And certainly the bottom line of any ROI in healthcare is things associated with volume, right? So when we have we're aware, right, of the seasonality of when these awards come out, and thus the campaigns that we have. So we measure volume in a broad sense of our entire health system and all the service lines to see if there's been any measurable impact. And then, of course, when we get granular, when we know we have a digital ad running, perhaps impressions, views, clicks, interactions, those types of things also kind of help quantify perhaps the anecdotal impact of the campaign, right? Did this increase your brand awareness? Did this increase the understanding in the community of these top awards that you have? And perhaps a third item that we use to measure, because this is such an integrated part of it, is actually our hire rates, our hiring rates and recruitment, because attaching these message points to our collateral and to our talent acquisition efforts is key. And we're able to measure and track and trend both the gross hiring rates we have, but then also with respect to openings to certainly see how did we do this last month with the recent Healthgrades awards that we had? How did we do with hirings? Also, what was compared to the opening of positions, and then let's compare that to the previous year. And what I mean with respect to the opening of positions is, say we had 10 hires this month and 15 hires prior year same month. Well, if there was only 11 openings in this month, 10 out of 11 would be indicative of a really strong campaign, where perhaps last year's 15 hirings came when we had 60 openings, right? So just kind of trying to glean some of those nuanced pieces of information as it relates to defining ROIs is really important.
Mark, that is wonderful, and I love the detail that you shared. I think that's going to be very beneficial to many in the audience. And Stephanie, maybe to move to you, I know you shared some tactics that you've used to kind of fight the larger unnamed system in the Twin City that might be trying to direct patients away from you. And I think you've had some very successful tactics to generate awareness and get some earned media around your strategy. So I'd love if you could share a little bit about some of the specific tactics you used, and then also
Yeah.
maybe some of the different measurements that you're looking at River's Edge.
Yeah. So as far as kind of some tactics that we've used is, there's a really large orthopedic practice in the Twin Cities metro area who is expanding with outreach clinics really everywhere in the state of Minnesota. So it's not exclusive to Southern Minnesota by any means. But when that's knocking on your back door, we really felt like we needed to kind of broaden our name a little bit and tie in that Healthgrades recognition up in the metro area where it's likely to be a little bit more recognized than maybe in the rural Southern Minnesota area. So we took a look at some strategic locations where there might be some billboards open that are kind of in that gray area between service areas. So we started doing some marketing in that area, putting up billboards, just letting people know about the designation and the quality. And that there's another option available for orthopedic care that when you're in a rural area looking at 50 miles to the Twin Cities, there's another opportunity 50 miles from where you live where you're maybe going to get some more individualized care. So that's pretty still new in what we're doing. Those billboards went up in February. So haven't really seen a whole lot of information coming off of that yet, but looking maybe towards the 9-month time frame where that will be coming in. One thing that I like to tie into the metrics is just I'm a big fan of comments, whether it's on social media or coming back on our surveys. The social media comments are great because you're getting some real-time feedback when you post things. Our strategy is very similar to what Mark outlined as far as, posting the recognition on social, linking it back to our website with a full article about the designation. And it's so validating to hear patients see what they say on our social, like so proud to have had my surgery done at the #1 hospital, great asset to our community. And from my perspective, those comments, because we're in such a small community, those have more weight to me than any number of clicks or that we have a fantastic click-through rate. All of that matters, but it's really the voice of the customer is what is making a difference.
That's wonderful. Yeah. Darian, anything to share from your end? I know that you touched on some of the things that Mills Peninsula already has in market right now. I'm not sure if you any other specific campaigns or strategies that you'd like to speak to, or from your view as CEO, some of the measurement calculus that you put around this investment, perhaps first or relative to some other marketing investments.
Absolutely. I think Mark and Stephanie did such an exceptional job, I think, reviewing some really shared common tactics that we're certainly deploying as well, and touched on really some astute ways of measuring it. And so I'll probably touch a little bit on that, or at least expand upon a couple of things. I think Mark had mentioned the fill rate for caregivers and open positions. I think there's also sort of the dynamic around applicant rate, and which is a slightly different measure that's complementary, but we've seen a pretty material increase in applicants for our positions over the last year. So both a fill rate, but also an applicant rate, which we're really excited about. And one of the things we really view as this marketing recognition, both physically on the building, through virtual channels such as social media, as well as internal communication channels, intranet pages, video content. How do we bring visibility, to it meaningfully, internally, externally, Rotary clubs, community groups, things of that nature. We've seen, obviously an increase both in the applicant rate. To Stephanie's point, we're seeing it in the patient surveys. But one of the things I'm certainly going to be excited about, taking a look at as well, is we're seeing it in the caregiver engagement surveys as well, right? So when we think about where exceptional care starts, it's the people who are providing that care. It's the physicians that Stephanie referenced that help them differentiate in orthopedics in their market, right? And be a national leader in that regard. It's the caregivers, Mark had mentioned, orienting very early into a culture of clinical excellence. And fundamentally, we feel leading into that, understanding and that embrace for our caregivers and making sure we're attracting those folks is the basis of the clinical excellence that we provide. And so I think from a measurement standpoint, seeing that directly in their comments from our caregiver engagement, improved retention by upwards of 30% really over the last year, 10 to 12% or so increase in applicant rate for our positions, right? Along with continued, consistency and sustainability and the quality performance and improvement. So those are the things we look for, and we continue to see it. And then there's obviously the anecdotal pieces, because our communities want to be proud of the facilities that are in their communities, right? I think that's something that we frequently underappreciate, but we as healthcare entities largely represent large employers. Their friends, family members work at our entities. They want to be proud of it, and being able to share this in a meaningful way when we go out into the community to hear them sharing how proud they are of our recognitions is a measurement of into itself as well.
Yeah, and we've got maybe one or two themes left to hit on here. We've got about 15 minutes left to the top of the hour. I just want to take a moment to remind our audience members that we will be doing Q&A. So if you have questions, please use the Q&A feature on the Zoom chat, and we'll get those asked here in maybe the last 10 minutes or so. Before we get to that, I do want to hit on two things. The first, and I'll throw this out to the group, do you see the awards as part of specialty specific outreach and campaign strategy as a broader branding tool, or as both simultaneously? And I'm curious if you could just, kind of maybe take a minute to share your thoughts on that. I don't know, Stephanie, Mark, Darian, yeah, please.
I'm happy to jump in quickly, given the time and hand over to the team here. I think the simple answer for us is both, right? I think our overarching brand recognition and differentiate in the market based on, exceptional network of care and differentiated quality and clinical excellence is that kind of overarching recognition, particularly, let's say as a top 50 hospital in the country, but the individual specialty specific recognitions are a part of the messaging as it relates to the program development work in specific service lines. And we continue to see pretty robust growth to the measurable volumes that Mark had highlighted, earlier. And I think a key piece of that has certainly been our articulation of the awards and recognitions that we've received across those service lines. So simply put, for us, it's both. But I'll hand over to Mark and Stephanie.
Yeah, I would echo what Darian said. It's both for us as well. It's driving volumes in other areas, because if the community sees we're good in one area, why wouldn't we be good in another area? And on the flip side, internally, it's not only our med surg or our surgery team. This recognition is for the whole organization. So it's driving excellence in all areas of our facility, from registration all the way to housekeeping and maintenance, because everybody knows that everyone has a piece of that work, and it's truly a team effort. So it's driving excellence internally and externally for us.
Mark, anything from the perspective of Prime and St. Mary's?
It's echoing what my colleagues have shared. I think depending on the strategy, there's purpose to both. When you talk about whole organization, health system wide recognition, that certainly is key. Perhaps those are a little easier to digest too, for community members if they see something as top hospital, patient safety excellence, right? They're certainly aware of what that means. It's really easy to engage with. And then when you have specialty, I think some of the direct outreach to service lines is also critical, right? If you're a leading site for hip replacement, that the marketing you do behind that might be a little bit different and a little more targeted than say the outreach you do for, again, some of these kind of overarching or larger recognitions at a system level. But to echo the point shared, there's certainly need for both.
That's excellent. And Mark, to stay with you, and Darian, please, I think this will intersect with you a little bit as well. Again, we've got lots of folks on the line who are members of, multi-site health systems, and who are, a hospital that's perhaps competing with a hospital that is under the same banner as their own in some services, or perhaps for market share in the same area. And Mark, I'm curious, kind of as a leader within Prime, and Darian as a leader within Sutter, if you could speak to any of the nuances to really maximizing these awards, while also, not running afoul of perhaps, system, brand or marketing goals, making sure that this slots into and doesn't necessarily conflict with those broader, national perhaps strategies.
Sure. I think the first place to start for that is really deferring back or leaning back on the clarity and the transparency that's built into the award, right? So starting from the standpoint of this is publicly available data. You can't pay to participate. Typically thousands, if not all, acute care hospitals are eligible. And so that's obviously highlighted in these publications and in these releases, and we don't shy away from that. In fact, we embrace that. And so that can really help behind when it comes to if there's any skepticism behind some of the claims that we may make, again, at the health system or hospital level. But then B, I think that transparency really increases the rate at which the information is received positively by consumers and by patients, because you're helping explain why they need to care about this, and why that, hey, this is coming from an objective third party. And I think some of the challenges or the barriers that you could run into if that wasn't the case is how you steer clear of it, right? With that, because if there is a competitor in your health system that may not have this particular Healthgrades awards, they're probably still going to have some others award that they're referring back to. And so you're going to always have, right, those constant clashes, I think, of messaging points. So whoever's can be, I think, the most direct and the most clear and the most transparent is what's going to be the most positive. Then on the Prime side, because we have health system recognition, and then also individual hospital awards, and some of the hospitals are in close proximity to each other, it's really treating them as ways that can be, collective or symbiotic of each other, to where if one hospital is a top 250 and the other one is patient safety excellence, but they both don't have those, right? We don't view those as a reason to hinder or to pull back, right, on promotion of either, because in their lane or in that category is something that is, rare, it's exceptional, and it's really, really important to talk about the positives and the why behind that. And that's what we focus on and really, put the resources towards to execute that message and get it out.
That's great, Mark. Thank you so much. Darian, anything to add to that? I'm not sure if Mark left you much room.
No, he did a great job. Happy to touch on it, just from our organization standpoint. We operate as a, one Sutter organization, all of our entities. I think Mark used the word synergy, collaboration. The reality is, even where there may be overlapping kind of primary service areas and things of that nature, we're one network of care. And so I'd mentioned the transformative kind of experience we're going through as an organization, and really a philosophy shift, a paradigm shift at our system level executives, to recognize we need to celebrate not only the holistic recognition and the exceptional, I think we're one of the most celebrated organizations from a Healthgrades standpoint across the country, even being localized largely in California, but also celebrate exceptional clinical quality and differentiation where it's at, right, within our individual facilities. And I think Mark had highlighted this, the ability to recognize, exceptional work that's happening at Sutter Health Mills Peninsula Medical Center inspires, our teams as we work together hand in hand to help elevate every facility, every service across our entire network of care. And so I'll just highlight there. We're in an organization that recognizes both the broader recognition as well as the necessity for us to elevate where excellence happens, understanding none of us are satisfied with where we are today. We're all trying to get better day in and day out. And I think sort of celebrating the wins amongst our facilities is a part of that journey that we're on.
Darian, I love what you said. What gets celebrated gets replicated. So I think that's a great kind of, point to put on the end of this conversation here to some degree. And we've got a couple questions that I think tie in together that I want to put out to the group here to get some feedback for the audience. And the two questions I'll kind of mash up here are on one side is kind of the attribution piece of it. And, how are you able to identify and attribute the performance gains that you have to the awards? And then also is how are you getting executive buy-in to license these awards for the hospital? I think those are related and connected, and I think the audience would benefit from your thoughts and views on those questions. So I'm not sure, Mark or Stephanie, if you want to start.
Sure, I'll start. We first received our first Healthgrades recognition about 18 months ago, and when it came through, I got a little bit excited. And we're a small organization, we don't have a lot of red tape to go through, so the decision to bring it forward was a no-brainer for me. And as a member of the C-suite, that access to my coworkers is pretty easy. The investment for us, while looking at the cost of what our contract is, at first I was like, whoa. But it was really kind of looking at the cost versus the benefit. And for us, really looking at what Healthgrades means, the reputation of Healthgrades, knowing that it's a leader in, a place where consumers can go to find quality health care, and what we get from it on the back end. It was really, we had very little discussion about whether or not to sign the contract. And it's something that I have no regrets at all over. It's been really beneficial for us. It has generated some excitement in our community and with our staff and with our physicians, not just at the orthopedic practice, but, across the board. So for us, it was a pretty easy decision.
Mark, Darian, anything you'd like to layer onto those comments? Perfect. I know we're running up on time here, and so want to just reiterate my appreciation for all of our attendees taking time out of your busy day to join us. And I really want to express a heartfelt thank you to our panelists for taking time to share how working with Healthgrades and celebrating the clinical performance of your teams has really acted as a strategic differentiator for your organizations. I know we've heard great and impactful anecdotes today from each of you about how this is really moving the needle with your organization and really helping to set the bar and the trajectory for your continuous quality improvement efforts. And I personally look forward to continuing to celebrate your organization's achievements. And I want to just, we've got a few minutes. If there's any closing comments that any of you would like to add about your organizations, your performance, or any of your experience with Healthgrades, we are very receptive to that. But we are also want to be respectful of everybody's time here.
No additional comments necessarily, David. Just want to say thank you again for the opportunity to join the panel and to have this great discussion.
Likewise.
Thank you very much, all of you. without further ado, please get back to the important work all your hospitals are doing. And we look forward to sharing updated Healthgrades 2025 quality award results with the broader healthcare community here in the fall. If you've got any questions about your hospital's performance, please don't hesitate to reach out to the Healthgrades team. All that information is available in the webinar landing page. And just to reiterate, Healthgrades is here to help you promote, measure, understand, and improve your clinical performance. So if you don't have strong awards today, we're a resource to help get you there for tomorrow. With that, we'll wrap the webinar. Thank you all. Have a tremendous day. Have a great week. Thank you for your participation.